Hello and welcome to another episode of Transforming WHO, the video series where I talk to global health leaders and colleagues inside and outside of WHO about global health and about the World Health Organization and how we transform and reform for greater impact in countries. And today I'm very happy to be joined by Dr. Chikwe Ihekweazu, who is the Deputy Executive Director for the WHO Health Emergencies Program and also currently for a couple of months more. He's the Acting Regional Director of WHO in the African region. And welcome to you, Chikwe.
Thanks, Aaron. Great to be on your show.
Thank you for joining. And first, a little bit about yourself. You are of German and Nigerian background. And when you get to know you, I mean, you have the best of both in you, I would say. And that is very clear. You grew up in Nigeria, I believe in the southeastern region of Nigeria. It must have been at the tail end of the Biafra war that was there. And then you went to university in Nigeria, got a medical degree, worked in the field as a young doctor, then transferred to Germany for postgraduate degrees in epidemiology, infectious diseases, worked for a number of European institutions, Germany, Robert Koch Institute, public health authorities in the UK. And then I think around 14, 15 years ago, back to Africa, working in South Africa, National Institute of Communicable Diseases for 5 years. And then the president of Nigeria called you in 2016 and basically tasked you to lead the Nigerian Institute of Communicable Diseases, right? Is that sort of more or less capturing you?
Absolutely. You know, it's quite a story. Lots of coincidences from the circumstances of my birth in Germany to my professional career. I never thought that I'd end up in public health. So,
No.
I was, like most young doctors, I think we're all preparing for a journey in clinical medicine, right?
Yeah.
And then, something got me into doing a master's in public health in Germany. And then, started a kind of diversion that became...
We have a picture of you back then. Can we bring up the first photo of Chikwe? And here we are. There you are in the laboratory in Nigeria in the lab coat. It's approximately 10 years ago. And of course, I mean, and you have been very much credited in your 5 years of leading that in basically building up the capacity in Nigeria to diagnose, risk assess, and also respond to communicable diseases. And then, of course, that also brought you into responding to COVID-19. We have the next photo of Chikwe during COVID-19 in Nigeria. Of course, also then very much becoming a public face of responding to the pandemic. This is for, I believe in 2020, a government conference. You are demonstrating how you can be scanned for temperature. So take us back, I mean, the 5 years in Nigeria and 10 years in Africa. What did you learn about public health?
Yeah, I guess the first thing, when I got called to lead the NCDC in 2016, of course it came as a surprise. I hadn't applied for it. I wasn't really formally approached for it.
But you couldn't say no to
I couldn't say no to my president for sure. But, Søren, on the other hand, it was also the job I probably would feel most prepared for.
Yeah.
I had coincidentally worked for National Public Health Institutes all my career before then, right? In Germany, in the UK, and then South Africa for 5 years, and then was invited into Nigeria. So, it was on the one hand sudden, but on the other hand, I felt well prepared for it. And, Nigeria is a big country, over 200 million people in the middle of the tropics with, very high population density, challenging socioeconomic circumstances, government that is always trying to lift the country up. So, but I think I say that if a virus had to decide where to emerge from, there's probably no better milieu than in Nigeria, right?
Yeah.
We had many of them from, Lassa fever, yellow fever, the first resurgence of Mpox, unfortunately. So, on the one hand, a challenging job, but, if you love your job, you want to be doing the job where you can be busy all the time.
Make a difference.
Absolutely. So,
And you became very much a vocal voice, Chikwe, of how the African continent and public health in Africa and the governments needed to basically demonstrate the capacities and have the capacities on their own. And you did that with...
Absolutely, Søren. But, I must say, I really learned, I had an incredible opportunity of coming to Europe and learning. And I think that's very important. When you have those types of opportunities from our continent, you also have a responsibility to use it for a little bit more than anyone else, right? So when I got in there and I saw the challenge but opportunity, I dug in with everything I had to build. But I also reached out to, I don't think there was any colleague I worked with in my 10 years, 15 years in Europe prior to going back to the continent that I did not reach out to later to come and help me. So everyone I knew had to support me one way or the other, either accepting colleagues for some short training or for conferences or to send us reagents. I was basically an entrepreneur in a public health position. What was the biggest
achievement in your 5 years in Nigeria leading the institute? What was the biggest? What are you most proud of?
What I'm most proud of is a whole cadre of young Nigerian public health professionals that I worked with at NCDC.
Yeah.
That grew so quickly because, what I did was give them the opportunities for professional growth and opportunity. I remember colleagues that got their first publication, right? And the impact, and suddenly they said, wow, I can have, a publication in Lancet, in BMJ. I could go on a mission because we have a federal structure in Nigeria, so we would send out teams to the states to investigate a cluster of whatever was going on. And they would lead a team with NCDC jackets and go on an official car. And, it's the empowerment, the empowering nature of our work. And once you start tasting that, you start looking forward to it. It's self-motivating. You work harder. You start growing. You seek more knowledge, and something is triggered in them. So now, they're seeded all over, still in NCDC, but also in many other public health institutions. So, there are many things that happen in those years, but I think it's that bit that, gives me the most satisfaction.
And of course, there's an increasing reckoning over the years in the African continent that Africa needs to stand more on its own legs, especially when it comes to public health and public health capacities. And also after the pandemic, basically there was a lot of inequity and countermeasures, especially the vaccines that stayed in the global north. And then now there's a reckoning Africa needs to have research, development, capacities for producing.
Yeah, so, and all this, you're absolutely right, and it's very emotionally appealing, and I buy into it completely, but it's a marathon, it's not a sprint. And this is something I say all the time. Over the last few years, there have been a lot of, the theme of decolonization, as it's called, and, local manufacturing, and, all of them are drawn by very legitimate interests of building up capacity on the continent. And I'm very vocal about that. But I also recognize that this will not happen overnight. It takes diligence. You have to build capacity. Science is hard. It's never a short-term effort. You have to build, grow, develop, build up a community. So I think the first thing has happened. There's that kind of recognition that this is where we need to go. But now it's it's the effort to keep doing this. Don't give up. Build up local partnerships, South-to-South collaboration, and there are many exciting things going on in that direction.
And now, of course, there's a new, very substantial challenge in global health, which is sort of a new policy from politics from the U.S. government, withdrawing from WHO, withdrawing funding not only for WHO, but for global health and many programs, especially in the African continent. How do you see that?
Yeah, so, development, the way it's been structured in the last 30, 40 years, has always been a double-edged sword. Many of us have seen this for years. It's just challenging, because yes, the opportunity of donor funding and support to our continent has saved literally millions of lives, right? From antiretrovirals, the access. My career started really kicking off in the early 2000s when no one thought, it wasn't imaginable that people living with HIV and AIDS in Nigeria and on the continent would have access to treatment. So all that changed so fundamentally, and those programs were started and many people have benefited from it. The challenge with that model is, when people do things for you, you lose the motivation to try to find solutions for yourself, right? Yeah. So it led the entire continent more or less in different parts to levels of dependency on aid that were not sustainable. And the challenge at the moment is not the fact that countries now have to do more for themselves, is the acuteness of the changes that we're seeing, right? And which has caused the most problem. But, and really challenging because right now, as we speak, I know many people that have lost access to treatment, lost access to all sorts of programs that were basically targeting the poorest of the poor in many of our countries. So there will be very hard consequences of what is going on now, and as a global community we have to take responsibility for that because it's happening under our watch. So we have to work very hard to mitigate the impact. But I also hope that it is a wake-up call for many countries in the so-called global south and our governments to think about that model again, to invest in their own
and also to think
health.
about the dependency on a few large donors. And basically,
I go to Nigeria, I see every day, every time I go to a city, I see a new flyover, big roads, big highways, and all great. Infrastructure projects are great. But I personally don't see why, if we can build our own roads, flyovers, airports, seaports, we should be able to be buying vaccines for our own children, TB medicines for our own patients. Yes, and doing it on your own doesn't mean you don't collaborate with others. We live in a global community, but so I do think there's maybe some good to come out of this in the long term, but we have an incredible responsibility to make sure that too many people don't suffer from the immediate consequences.
And of course, also stronger and stronger academic environments in the African countries. I've personally seen that. I mean, not less and less dependence on the global north and more having educated, like you were speaking to in Nigeria, new cadres of public health academics and practitioners.
I just came back from an incredible conference in Kigali, EHIC, and just so inspired by the science, by the energy out of the continent during a period where there's a lot of doom and gloom around the world, right? And so it was always almost challenging for me being there, seeing the enthusiasm and the energy, and watching TV late at night and the doom and gloom everywhere. But it's the reality,
Then you get another telephone call in around 2021. I guess you get a telephone call from Dr. Tedros, the Director General of our boss, also my boss, and he asked you to basically step in and become Assistant Director General and eventually also Deputy Executive Director. And one of your tasks that he tasked you with was leading the establishment of the Pandemic Hub in Berlin, which is a new sort of innovative, it grew out of WHO transformation, by the way, which is basically a hub, a center, a very innovative one. I visited your center in Berlin, focused on public health intelligence and basic preparedness. Can you speak a little bit to why did you accept that offer and what has that experience been like?
Thanks, Søren. Two things. Firstly, I think just reflecting recently, it's my second startup project in public health, a rare, unique opportunity. But I think during the pandemic, we lived through a shared experience around the world that, in public health normally, and you would recognize this, when we're asked to solve problems, we take our time, we collect our data, we mull over answers, and, but during the pandemic, it was a different scenario. Public health leaders had to stand either beside their ministers, sometimes beside the president, sometimes every single evening to explain to the population what was going on, where the pandemic was going, who would be affected next, what to expect, what are you doing about it. So the shared experience is that almost everyone felt ill-prepared for that, of having access to the data, the analytics, to provide the answers that people were requesting. So I think it was out of that problem that Dr. Tedros and colleagues at the time thought it was necessary to set up a new center that will enable, support the world and countries to be more agile, more quicker, more detailed in providing answers very quickly, being able to analyze data. And, when we started, we framed this as a technology challenge, right? But very soon we realized, yes, there's technological necessities and opportunities, but really this was a people's problem, right? How do you bring in the right expertise in data science? How do you navigate the very complex regulatory landscape around data on health around the world and build confidence? So a lot of our work initially was just building trust and confidence. But now, the center is doing very well. Lots of exciting projects in connecting the dots around the world. And I think the world will be in a much better place that we have the hub for pandemic and epidemic intelligence.
For the next pandemic.
Yes, we are, for sure. We may not be exactly where we want to be, but we are by far better prepared in this space, right? In our ability to collect both data on pathogens, on humans, on the population, on the environment, and connect them across geographies, across professions, across sectors. Our ability in that regard has increased exponentially. Because, like we always say, we don't know. We're almost sure there'll be another pandemic, but there are many opportunities for new pandemics to arise every single week around the world. But they're detected and there's a response and no one hears about it. And that's what makes our work in public health sometimes so
going
tricky.
Back to the early days of 2020 when COVID-19 hit the world, I mean, we were much better prepared. We did share the intelligence much more rapidly than previous pandemics, the SARS, MERS, and we had the influenza pandemic in 2019. And we were also better equipped to develop new countermeasures more quickly. So we are evolving. So,
We're also evolving in different ways. You have real-time TV, you have internet.
That is
so
true,
there are opportunities for populations to criticize and hold us. Absolutely.
And also a more globalized world with more travel, etc. Yeah, that's for sure. So currently you are then back on the African continent. Now you're here in Geneva this week, but apart from that, you've been tasked to act as regional director for the African region until we elect a new one in May. Unfortunately, the RD-elect, Dr. Ndukulile, passed away very, very tragically, so there's a gap. But you're back now in the African region. You step into very big shoes because Dr. Moeti, who led the African region for 10 years, she really transformed WHO and Afro. When she came in 2015, it was a lot of reckoning in also the deficiencies of WHO and others respond to the outbreak of Ebola in Western Africa, for sure. She transformed very much the region. So how do you see, coming back to the region now, how do you see that?
Thanks, Søren. It's really big shoes to step into. And yes, all credit to Dr. Moeti, stepped into that role in the middle of the Ebola outbreak in 2015, which was really, it had such an impact on the world, on the continent, but also on our organization. The WHO Emergencies Program grew out of that outbreak. But going back now, expectations are sky high, but I have only 3-4 months. I think my key task is to get our regional office and the team ready for the future. The world is changing around us literally every day. Countries are changing. The capacity you could see from the Rwanda's response to the Marburg outbreak recently, how much the country insisted on doing for themselves, and they were able to do a lot of the work for themselves. So WHO of 20 years ago, where countries were looking to WHO to come in and solve their problems, is not WHO of today. And so we have to evolve. We have to become much more agile, dynamic, responsive to needs of countries. I wouldn't be able to solve all these problems in 3-4 months, but I think we can move a lot forward. And I've really enjoyed the enthusiasm with which the team has received me in Brazzaville. Have already visited a number of countries, been to DRC, Nigeria, Rwanda just last week. So yeah, I think there's an energy around the organization on the African continent that is really exciting.
And also new actors, I mean, especially the African CDC, which was launched by the African Union, and which is in many ways a very good partner, but some would also say a competitor of WHO. How do you see it?
I don't see it as I don't see Africa CDC as a competitor. I think there are more than enough problems for all of us to solve on the continent, and I'm going to visit Africa CDC next week, visit the Director General Jean Kaseya, and I'm sure we'll do great things together on the continent.
Yeah, because it is needed, as you say.
It's needed,
yeah.
absolutely. We are the continent, unfortunately, with the worst health indices. So we have a responsibility to work together and solve as many of those problems as we can for our people.
And also with the current challenges, I mean, we already touched about the funding challenges, but there's also a broader challenge to multilateralism that's been being discussed for a number of years, that this rule-based international collaboration is perhaps more challenged, not as strong, or we have to work more to strengthen it.
Yeah, I think on the continent, we are particularly challenged because we're probably the one continent that, the geographical distribution of countries had little to do with a natural progression of cultures and people. But we have learned to live and work together. It's work in progress. So within that context, multilateral organizations are very important. I think it's an opportunity for the sector to reset. But, I can't imagine a world without WHO, for instance. The opportunity it provides for us to think together, work together, share problems, share solutions, especially those things that, the political boundaries as we know them are not sufficient to manage the infectious disease threats or all the other threats, climate change, all the contemporary big challenges that we face. The borders that we've drawn on our maps matter very little, and that's where multilateral organizations are so important to enable us reach consensus on how to approach them.
And some would even say that the special mandate and leading and convening role of WHO is even more important in this challenging.
It's more important than ever before. When I was working in Nigeria, I remember, when I was working at the national level, and very often, all sorts of NGOs, companies come to you with all sorts of solutions. My first answer to them was, what does WHO say? Is there a WHO guideline that provides advice on this? I'll call the World WHO rep in Nigeria and say, please, I've been offered a new test or a new medicine, kindly advice. So that role is so important and bringing us together. One of the first opportunities during the pandemic to bring colleagues together to agree on how to respond were WHO convenings, right, together with Africa CDC. So I think in many parts of the world, the part of the world I come from, I don't think there's any ambiguity at all on the relevance of multilateral organizations and the future they have.
And the future of, and also of WHO. Yeah. Thank you very much, Chikwe, for taking the time and for visiting here in the studio in Geneva. I wish you all the best in your current efforts in the African region, and safe travels back to Brazzaville when you go later this week.
Thanks, Søren. We'll do my best for the next few months.
Thank you very much, and thank you, colleagues, for watching this episode of Transforming WHO, and do stay tuned for more episodes.